Hello, this is Joe Simpson with Gemgenics. I want to introduce you to our new software, GenoScribeLive. GenoScribeLive is a complete medication plan assessment that takes into the patient's individual genetics, drug-drug interactions, contraindication, anacholinergic burden, Beers list criteria, lifestyle risk, and all of those things that make up the risk for the patient based on their individual medications. Once your report's back in your portal in typically 3 to 5 business days, the first thing that you would want to come into is or have your nurse or MA log in, and they can add into any of the lifestyle factors that may from this individual patient. Are they a smoker? Do they drink alcohol? Anything that would increase the risk of the medications. You can click on the indications, make sure that all the ICD-10 codes were loaded correctly. If there's anything that's missing, they can put those in because, as you know, different indications may have a higher risk factor. Once we get into the regimen, the nurse can double check and make sure that all the drugs were loaded correctly in the regimen, and anything that wasn't in the regimen, it's a simple type and it will autofill and you can choose on one of those. But the most importantly, when we get to our report page, when the report page comes up, a couple things on the report. To the left, these are the most frequent side effects based on this individual patient and their risk of a headache based on the medication, 71.8%, nausea 67.1%. Out to the side are the medications that reach or that add to the nausea. And over to the right, quickly, if we just want to know which medications is the worst for this patient, female 85, we can see right here that Doxepin has an adverse drug event risk of 85% itself. When you look at the different color codes down here, so on genetics, there's some pretty high genetic information. It says exclaim compared to Plavix and metoprolol. It tells you to stop. These medications are not genetically being metabolized by this patient's individual body. The other things that we look at as far as contraindication, drug-drug interaction, you can hover over any of these bars and it will tell you what all the drug-drug interactions is, the green being lifestyle, so this drug interferes with alcohol. So it's a quick hit for you to know which of these drugs are the highest risk. Down at the bottom of the report page, we take all these risks and we break them out like the flags in your EMR, but we break them out so by severe, major, moderate, and minor. So for this individual patient, there's a couple severe, the anacholinergic burden, the Beers list criteria, black box warning on Doxepin, and then also genetically the stops. We know that Plavix and metoprolol are not working for this patient. If you want to go down and look at your majors, you can click on those and go in and look. So we have 3, and you had where we had the exclaim, so pretty strong information about Doxepin for this patient, and then drinking alcohol with the drugs that it interferes with. So it gives you a quick look into this patient and some things that you can do to make those changes. But at the bottom, the alternatives tab gives us the ability to come in and look at this individual patient, knowing that Doxepin was our worst drug for this patient, and to be able to go in and look at the tricyclics and see, is there a better drug for this individual patient? What is the best drug for this patient? When it comes up, it's going to show you every tricyclic out there, and it's going to show you if it's green, yellow, or red, green being better, and we rank them by the second column, the regimen. So you have a drug that's 49% better. There's a generic out there for $1.33. You can literally click on the drug, hit update my model, and now you can take a side-by-side comparison. So where this drug was at 85% with Doxepin, now my highest risk drug is metoprolol down at the bottom. You again go back, go to select a beta blocker, and choose what's the best selected beta blocker for this individual patient. The software is going to run quickly through all the beta blockers out there, and it's going to give you choices. So these top 3, 25% better. I have a generic out there at 35 cents. I literally can click on there and update my model again. And as I keep looking at my alternatives model, I keep seeing my risk move over closer to the left. And so as it updates and changes all these drug-drug interactions, as I clean this up, it gets better. If you look at with the Beers list criteria that Medicare is now wanting us to look at some of these drugs, you can literally, like Celebrex, maybe it's PRN, and I can just see what it does if I take it out of the regimen. Now looking here, I'm starting to get down that 25 to 30% risk rate. And so I have Plavix that we still know there was a stop. So to just make a couple of changes quickly, I can come back into the Plavix, hit the add alternative again, and go in and look at, so here's the actual best drug for this patient. Update my model, and again, I've got my risk down to where I'm in that 30% range. Once I like this drug regimen, I can click on the Save Updated Regimen, and it will override it in the system so that I have a truly interactive report for this patient. After you've made your saved updated regimen, it will override in the system, so you don't have to redo this. But just for today, I'm going to skip and not save it so that I go back to our normal demo. And if you wanted to, patient came in today and you wanted to add a drug such as Paxil to this patient, you can literally click on the drug, load it in the system, and before I would ever write the drug, I want to go in and see what does this do. Well, Paxil ends up being the second worst choice for this patient. So again, I could just go back to my alternatives page, and before I would write it, I could literally come into Paxil and being an SSRI, look and see what is the best drug out there for this individual patient. So the computer will quickly pick that. So it changes the way we write in the future. We still will have to choose what our dosage is, but it gives us the ability to know that this is the best choice for my patient. And so here would be the number one best tablet if I wanted to write the tablet, and there's a generic out there for 10 cents for this patient. So I could literally click on that, update my model, and see how it changed it for the future. So it changes the way that we prescribe medicine going forward. I may not want to change another physician's medication without talking to that physician first. So I've looked at this and I've decided that there's a lot better drug than Paxil, or there's a better drug than Metoprolol. I can literally go into this report and take this medication risk report, and I can email this over to any of the other physicians so that they can go in and look at this, and we can share this information because it's free to send it over to any other physician, and the physician can log into this individual patient's report on the cloud, and then he too, and I can walk him through any of the medication changes and show him based on clinical data and evidence of how this patient doesn't metabolize a drug such as metoprolol, and we want to make a change over to bisoprolol. So based on, I can clean the med regimen up and suit it, individually tailor it to each individual patient. So going forward, it's going to totally change the way that we prescribe medication so that it fits every patient, and we know going in that that drug's going to work. And again, then all we need to do is adjust and titrate the doses. If you would like your own private demo and to be able to talk to me one-on-one, be glad to talk to you. Please call my cell phone at 501-416-3451, and I'll walk you through the software, or you may email me at joe.mgenix@gmail.com. We can set up a GoToMeeting and let you play with the software and take a test drive. Thank you for your time.